remarkable as it is that less than a year after this disease was found, we have a vaccine going into arms. Now we need to follow it forward over time.
So many unknowns, so many questions.
Ask me again in 6 months. We'll be gathering more information.
The COVID vaccine is new to all of us.
It is safe and recommended.
Allergies, efficacy, transmission. Top state and health leaders are addressing your questions and concerns.
Concerning and disturbing.
The actions of Aurora's mayor called into question.
I think that the mayor didn't seem to be taking it seriously.
Accusations that the mayor came to work sick days before testing positive. Tonight, Denver7 Investigates uncovers concerns inside City Hall.
He doesn't have a concern for the health of our staff.
Tired of caring for more patients than they can handle, local healthcare workers are taking a stand.
We are seeing currently a rate of burnout that I've never seen.
Denver's mayor urged people not to travel for Thanksgiving, and then he flew across country to visit family. And now Aurora's mayor, Mike Kaufman, is under fire for not wearing a mask and coming to work sick just days before testing positive for COVID-19.
Denver7 investigator Jennifer Kowaleski has the email calling out Mayor Kaufman for not taking the virus seriously.
And what's the ideas for Aurora's future?
He's the mayor of the third largest city in Colorado.
Oh, congratulations.
And now, the latest elected leader accused of ignoring his own coronavirus precautions.
A mask mandate may be inconvenient for a lot of people.
That's Aurora Mayor Mike Kaufman back in July, showing support for a mask mandate.
As far as bringing the COVID rate down and opening up this economy, I'll take a mask mandate.
Fast forward to October, and an assistant working in the mayor's office has raised serious concerns about his lack of precautions in City Hall. The city employee wrote out a detailed timeline of her exposure to Mayor Kaufman in this email to HR. She called it a health and city policy violation. In the days before he tested positive for the virus, the employee said Mayor Kaufman's cough was considerably worse, and the mayor did not wear a mask on numerous occasions. Then, on October 22nd, the employee wrote, "I noticed him shivering," and the mayor was sent home because he obviously was sick. 3 days later, Mayor Kaufman tested positive for COVID-19, sending out this tweet, he had it. The employee finished her email by writing, "I am angry that the mayor came in when he was so sick. With COVID, it can't be overlooked. Our policy to stay at home if you're sick is on posters all over the office." In all caps, she wrote, "It has been communicated clearly. Mayor Kaufman knows that the coronavirus is serious, and he knew when he came in that the virus is on the rise, and he came in anyway, and didn't wear his mask consistently. This was incredibly inconsiderate, disrespectful, and dangerous."
How would you describe that email?
Concerning and disturbing. I think that the mayor didn't seem to be taking it seriously.
Councilwoman Allison Coombs says the mayor's actions were irresponsible and put other people's health at risk.
Is it against city policy to come to work sick like he did?
It is. Our staff, I think, would face, as was said in the email, would face some kind of discipline.
The city's HR director responded to the employee's email, writing, "The mayor will be specifically reminded of the requirement and his responsibility to wear a mask, social distance, and not coming to work sick." As for Mayor Kaufman, he declined our request for an interview. In a lengthy statement, he wrote, "While I am sure there were times when I forgot my mask at my desk or held brief, distanced conversations without it, these were unintended mistakes, and I apologize if anyone felt at risk because of them." We asked Kaufman about his decision to come to work sick. All he would say is that when he experienced unusual symptoms, he left the office, followed up with his doctor, and followed guidelines on quarantining. For Coombs,
making sure our staff know that their concerns are heard.
She says it's another example of do as I say, not as I do.
I think it's deeply concerning how many of our political figures seem to not show a real concern or a sense that they're bound to the same standards with respect to COVID protections.
I'm Denver7 investigator Jennifer Kowaleski.
More shipments of the Pfizer vaccine made their way into Colorado today. We're talking 25,000 doses of the vaccine. 110 people received the vaccine today, and that brings the statewide total to 294 vaccines administered across a handful of Colorado hospitals in the last 2 days. More than 12,000 doses are expected to arrive in Colorado tomorrow. The governor has urged hospitals to administer their share of doses within 72 hours of receiving them.
We are still just in the first 48 hours of the vaccine being a reality in Colorado, and we know there are so many questions. Who can get it? When? Where do you get it? What say if you have allergies?
That's why tonight I moderated a special Denver7 town hall, joined by a panel of medical experts, including Governor Polis. Denver7's Gary Brode has a look back at the top 7 questions and the answers you should know.
From distribution to transmission and everything in between, we're covering 7 questions you wanted answered in Denver7's Vaccine Town Hall. And it's a question that came up more often than most. When is it my turn, and who will let me know when I'm eligible? The executive director of the Colorado Department of Public Health and Environment, Jill Hunsker-Ryan, says some of the public could start getting the shots as early as March. Until then, stay in touch with your doctor to make sure you know when it's your turn. And as for where to get it when the time comes,
people will be able to get a COVID-19 vaccine pretty much where they get their flu shot. So from their primary health care provider, from a clinic, their local public health agency, or pharmacies like Walgreens and CVS.
Well, what if you have severe allergies to things like peanuts, penicillin, or if you have other medical issues? Dr. Richard Zane at UC Health breaks it down simply for those concerned whether they should get it.
Patients under the age of 16 currently should not get the vaccine. And other than the allergic reaction to vaccines, there's really no one who should not be getting this vaccine.
Dr. Zane says getting the vaccine doesn't guarantee you won't give the virus to others, and that's why he says it's important to keep wearing a mask and social distance until we know more.
We don't know if you are protected from spreading the virus. We have to wait until there's a significant amount of herd immunity and enough of the population has become vaccinated and immune before we think about lessening those protections.
You do have to get both doses of the same vaccine, which means it'll take about a month for the 95% efficacy rate to take shape. But that still leaves the question, if I get the vaccine, can I still get COVID-19? Dr. Zane says yes.
If you contract COVID after having been vaccinated, it is much more likely to be a milder form than it otherwise would have been had you not been vaccinated.
So how long should you expect the vaccine to last? Well, Chief Medical Officer for the Colorado Department of Public Health and Environment, Dr. Eric France, says only time will tell.
Ask me again in 6 months. We'll be gathering more information to understand how well this vaccine creates long-lasting immunity from COVID disease.
And Dr. France also brought up a question we received. Will the vaccine have an impact on breastfeeding mothers?
Currently, the CDC recommends that pregnant women, lactating nursing women should all be vaccinated. Have the conversation with their providers.
And what about fertility?
I too have heard rumors about questions about fertility with this vaccine and having some impact. I'm not sure where they've come from. Certainly, there's no reason to think that would be a risk or an issue based on the science to date.
Gary Brode, Denver7.
And you can count on us to continue pressing health leaders to get your questions answered. In the meantime, you can watch the full 30-minute town hall right now on our website, on Facebook, and on your streaming device of choice.
The FDA has authorized the first COVID-19 at-home test that you can get at a store without a prescription. The company is called Ellume. The test costs about $30. It'll be available next month. So you swab your nose, get results within 15 minutes. It can be used for adults and children as young as 2. And the FDA says the test is 96% accurate, according to studies. Now, you might have heard us talk about the other FDA-approved at-home COVID test. Now, those are the ones that you send the samples off to a lab. Now, there's another that allows you to get results at home, but that one requires a prescription.
Tonight, the woman in charge of the state's largest school district is breaking her silence about why she's leaving Denver for a job in Dallas. Susana Cordova grew up in Denver, started as a DPS teacher 31 years ago, moved up to superintendent. After announcing a resignation, we heard from current and former mayors who blamed her departure on a dysfunctional school board. Well, I sat down with Cordova today. She says she never felt mistreated in board meetings. She doesn't believe it was a hostile work environment. She says her personal style is more of a collaborative approach, something not everybody agrees with.
Let me say, looking forward for the board, what I would really encourage the board to do. I think it's really important in any working relationship, but particularly in a school district, that the Board of Education have a superintendent that they have confidence in, that they trust, that they name the strategy, that they name the measurements, and that they work in full support of the gains that they are committed to making.
Looking back, Cordova admits she wishes she wasn't superintendent during a time of crisis. And when asked about any regrets, she would have liked to have had students back in the classroom faster. Her last day on the job is December 31st.
The state of Utah says its teachers and school administrators will be able to get vaccines as part of their phase 1, so getting the shot this month or next. Here in Colorado, educators are not slated to get the vaccine until phase 2, that is in the spring. Today, interim superintendent in Douglas County said he believes teachers should be getting the vaccines earlier to help students get back to class earlier. The governor says by the time, though, teachers and staff get vaccinated, it would have been too late to have an impact for this semester.
The timing of that vaccine is unlikely to affect the classroom practices for this coming semester, because while there will be teachers inoculated, hopefully February, March, April, that's just the first one. 30 days later, the second one. So if you get inoculated, March 20th, you're not really immune until the beginning of May, because you get the second one April 20th, and then it's the end of school. So that's why we have all this layered protections for teachers this semester.
The superintendents all across the metro met today to discuss getting kids back into the classroom. And the big things they say they need for success: free testing for students and staff with faster results, and symptom screenings.
And for the first time in 3 decades, public school enrollment dropped this fall. It's down about 3% from last year, which equates to about 30,000 fewer kids enrolling. About half those students are now being homeschooled. The biggest drops were for kindergarten and preschool enrollment. And with most students still learning remotely, the state wants to make sure that kids who don't have access to broadband get access. So thanks to a new grant, at the end of the year, more than 20 locations across the Front Range will be equipped with free Comcast Wi-Fi. They're called Lift Zones and will be scattered around parks and rec centers. A full list of the sites can be found on Comcast's website. Just search Colorado.
I can't take their vitals as frequently as I should.
Overworked, exhausted, hospitals are overwhelmed, and so are the healthcare workers inside.
We wouldn't have enough nurses for the number of patients.
Tonight, these frontline workers are making sure their voices are heard. Why they say forming a union is the answer.
It'll be a clear, cold one tonight. I'll let you know when the next snow will hit Denver.